Hi Sarah, my name's Teresa. I see you've got a bit of a problem with your nose there.
Yes, it won't stop bleeding.
Okay, how long have you had a bleeding nose for?
Probably about 5 to 10 minutes now.
5 to 10 minutes, yeah. Okay. Let's just move you forward a little minute.
Okay.
Okay, now what I want you to do is to actually pinch. Pop your glasses off for me.
Yep.
That's it. And we'll just pop them over here on the table on the chair. And what I want you to do is to just squeeze the bridge of your nose rather than here.
Yep.
And I do have something out of my bag, and we'll just give you a wee bolus just to hold on to. Just to put underneath your nose. Use the other hand there. So have you ever had bleeding noses before?
No.
No? Okay, and what's caused this bleeding nose?
I'm not sure. I just come home from work and I sort of hit my nose just because it was itchy and then it just started bleeding.
You hit your nose?
And I just sort of went like that.
Oh, okay.
Because it was itchy and it just started bleeding.
Right. Alright. Do you have any medical problems like bleeding disorders? Or
No.
Are you on any medications that thin your blood?
No.
No? Do you take any medications at all?
No.
Are you allergic to anything?
Not that I know of.
No?
No.
Okay. So does that feel like the bleeding stopped a little bit now you're pinching on the bridge of the nose?
Yeah, it feels a bit more controlled, yeah.
Okay, so you just probably need to just move your fingers up a little bit more and just pinch quite firmly. And what we will do is go and get you a cold compress for the back of your neck because that'll help as well. What's your blood pressure normally doing?
It's normally pretty good, yeah.
Yeah, okay. So what we might do in a couple of minutes is do your blood pressure, but just while you're holding on to your bolster there and collect any drips, I'm just going to take your heart rate. Sarah, have you noticed that the blood's coming out of one nostril or the other, or both?
Oh, I'm not sure. I haven't really looked. I've just seen it.
Right. So Sarah, what I'd like you to do is just to move those fingers up just a little bit higher, because it needs to be quite high and quite a bit of firm pressure, and just bring this arm down. I just want to have a wee look at your nose. Okay. So there seems to be a little bit of blood trickling out this side, but not the other side.
Okay.
Well, that's really good. Okay. Can you just open your mouth a wee minute and stick your tongue out? No blood coming. You can't feel any blood or clots coming down the back of your throat?
No.
Oh, that's excellent. Okay, just pop that bolster back in there. I'm just going to take your heart rate while I'm sitting here with you, and the cold compress is on its way. So with you whacking your nose, it was just with your hand that you hit your nose?
I just had a bit of an itch and I must have hit my nose too hard.
Right, okay. Your heart rate's pounding away there quite a bit.
Yeah.
Do you notice sometimes that your heart pounds?
No, I don't notice it though.
Right, and have you had any problems with your blood pressure?
No.
No?
No.
Okay. Alrighty. So what I want you to do is just to relax this hand a little bit, but keep that other hand firmly on your nose. If you bring this hand down, and I'm just going to do your blood pressure while you're sitting there. So it's just been a trickle. Did you notice what colour the blood is?
Red.
Alright. So it's not as bright red, it's not like a dark red?
No.
Okay, great. So I've checked your blood pressure, and your blood pressure is actually reasonably good. It's 120 on 80.
Okay.
So there'll be your blood pressure is not high. Sometimes a high blood pressure can cause your nose to bleed.
Yeah.
So that's not a problem for you right now. So as you said, you've probably knocked your nose and given a bit of trauma.
Yeah.
So what we might do is we'll give you a tissue in a couple of minutes, and I'll get a wee towel and pop it in front of you. We'll get you a tissue, and I'll get you just to blow the nose just very gently, and we'll just see what happens after that. You may need a little bit of treatment. We might need to pop a little bit of adrenaline up your nose, just to see if we can stop that bleeding. It's not too severe at the moment that I can see, so that's why I'm quite happy to actually let you relax your nose now, and we'll get you to just to blow your nostril into the tissue here, and we'll see what happens. Okay, and while we're just waiting to see what happens, I'll start some paperwork, and if the nose stays in this position where it's not bleeding, then we won't be needing to take you anywhere to GP or the hospital immediately. But I suggest that maybe if you keep having problems with your nose, you might need to go and see your GP. Certainly if it continues to bleed constantly, then you'll need to go to see after hours sooner rather than waiting to see GP the next day or up to hospital if you start to feel a little bit unwell with your nosebleed.
Okay, thank you.
Okay.